In this video, what I'm going to do is show you the specifics of the different endocrine organs that are in our lab book, and then I'm going to give you a quiz on just the appearance. And if you can get past the appearance quiz, you're ready to at least attempt the next part. But if you can't get past the appearance, just learn that first, details second. All right, so for your lab, you need to know the thymus, pancreas, pituitary, adrenal gland, and thyroid, parathyroid. So that's what I'll be going over. So the thymus is very easy. These individual units are the follicles of the thymus, and the follicles of the thymus all have an inner layer and an outer layer. The cortex is the outer, darker layer. The medulla is the inner, lighter layer. You're going to want to remember those two words, cortex and medulla, because you're going to see them over and over again throughout the rest of AMP2. The pituitary is also called the hypophysis. It's important to know that it's called the hypophysis because there are different words related to pituitary that are going to have hypophyseal in it because the pituitary is the hypophysis. So recall from AMP1, the pituitary is a gland that hangs off of the brain and it's attached to the hypothalamus via the infundibulum. Also recall from AMP1 that it is sitting in the hypophyseal fossa of the sella turcica of the sphenoid bone. So if you did really well in your skeletal practical, you probably remember what I'm talking about. If not, that's kind of okay. I'm just mentioning it because it is indeed in our lab book, and it is important that you realize where it is located. So there are two regions of the pituitary. There's the anterior pituitary and the posterior pituitary. So the posterior pituitary is also called the neurohypophysis because it is made of neural tissue. So this is the neurohypophysis. If you recall from histology, neural tissue is like paler pink. So think pale pink, posterior pituitary. That's the neural tissue. It's actually kind of like the pituitary, the posterior pituitary is almost an extension of the hypothalamus because nerves that begin in the hypothalamus come down through the infundibulum and create the posterior pituitary. The dark pink is the anterior pituitary, also called the adenohypophysis. That is made of glandular epithelium. Most glands are made of glandular epithelium. The only reason I'm specifically stating it here is to further highlight that yes, the posterior and anterior pituitary are made of two completely different types of tissues, and they originate from two totally different places. Like the posterior pituitary is coming down from the hypothalamus. The anterior pituitary, like I think as a little embryo, was originally cells that were like near the roof of your mouth that went upwards. The thyroid has these structures. So all these little circular structures are individual units of the thyroid. So they're called thyroid follicles. Thyroid follicles have two important components. There are these follicular cells along the outside. They make the thyroglobulin, which is essentially like incomplete thyroid hormone. And that thyroglobulin gets stored in this pink jelly area that is colloid. So colloid is a generic term for a type of a mixture. Like in A&P 1, you were supposed to learn that there are solutions, colloids, and suspensions. Like a solution would be like, I don't know, pretty much everything. Mineral water, Gatorade, that's a solution. They have small solvents. A colloid is a mixture that has bigger solutes. I think I just incorrectly said solvent. Solutions have small solutes, colloids have bigger solutes. Either way, that's just a generic word. The colloid is made up of mostly thyroglobulin. And the function of this is that the whole structure is going to make, store, and release T3 and T4. When we say thyroid hormone, we're referring to T3 and T4. All right, so also between the follicles, so remember this is a follicle, the cells between the follicles are called parafollicular cells. They release a hormone that has a function that is completely different from T3 and T4. They release calcitonin. Not going to go into physiology today, but calcitonin has to do with regulating your blood calcium. T3 and T4 is regulating the rate of your metabolism. Completely different hormones, and they have completely different pathways for release. Okay, this is the pancreas. You can kind of tell the pancreas from everything else because it has these islands that are like highly cellular. They are completely made of cells. You can tell that they are made of cells because if you look inside, you see a bunch of nuclei, which is a hint that it is cellular. Whereas the thyroid follicles we are just looking at, the inside is filled with a smooth pink jelly because there's no cells in there. So the pancreas is actually a mixed organ. We call it a heterocrine gland because it contains endocrine tissue and exocrine tissue. So remember, endocrine tissue releases hormones to your blood. Exocrine tissue is going to release some kind of a product outside, like your sweat glands are exocrine glands because they're producing sweat. Your sebaceous glands that are making your hair oily is exocrine. Digestive juices, that would be exocrine. Endocrine is only hormones going into the blood. So the exocrine portion of this is like everything that's not the islands. So those are called acini, and they release bicarbonate and digestive juices, which you will learn more about when you get to the digestive system, like what's actually happening. But just kind of know for now, like the pancreas has a little tube that leads right to your small intestine. That's where those products are going. The endocrine portion is the islands. They're called pancreatic islets. The older term is islets of Langerhans. But we're trying to get away in anatomy, like we're trying to stop naming things after like old dead guys, and we're trying to make them like make sense. Pancreatic islet is an easier name to remember. If you like Langerhans, lots of professors would accept that. So the pancreatic islets have alpha cells and beta cells. In this picture, you cannot differentiate them. At our school, you do not need to differentiate them. It's more important that you know what they all produce. I just remember beta. Beta releases insulin, glucagon alpha. So beta cells release insulin, alpha cells release glucagon. what we're looking at here, this is the adrenal gland. The adrenal gland, remember the posterior pituitary, or not the posterior pituitary, the whole pituitary had two very distinct layers. The adrenal gland also has layers, but it has more layers. It's not just two, and sometimes they're also a gentler gradient. This one is pretty distinct, but sometimes like this middle layer oftentimes blends right into the lower layers, right into the upper layer. Like it's hard to pick them apart. So the adrenal gland has a lot going on with it. Like I said, I recommend like learning things in layers. So the first layer of information here is the outermost layer is the capsule. That is connective tissue. That's not doing anything with hormones. That's just a little wrapper so it doesn't fall apart. Inside the capsule, the outer layer is the cortex. So that is glandular tissue. Like these three layers here are all part of the adrenal cortex, which is a true endocrine gland. So it's made of glandular tissue, and it releases a bunch of different hormones. There's a lot of terminology, but as a group, every hormone coming from there could be called a corticosteroid because it's coming from the cortex and it has the shape of a steroid. If you've gotten to endocrine physiology, you'll know that steroids are fat-soluble molecules. The inner layer, so if the outer layer is the cortex, what's the inner layer going to be called? And if the outer layer is it's glandular tissue, then what is the inner layer going to be? So if the outer layer is the cortex, the inner layer is the medulla. Outer layer is glandular tissue. This inner layer is nervous tissue. So as a group, what is released from the medulla are called catecholamines. Those are your stress hormones. Those are your I just saw a bear hormones. When people say adrenaline, they mean the catecholamines. You might be more familiar with the terms epinephrine and norepinephrine. Epinephrine and norepinephrine are catecholamines. All right. So the struggle of putting a presentation together really quickly in one day and not knowing what you set to come up next. The surprise of it. Okay, so there are three layers of the cortex. The zona glomerulosa, the zona fasciculata, and the zona reticularis. So that's just the name of the region. If they want the region, you have to say one of those things. And look at the initials, it's G, F, R. Today I was really struggling to come up with an acronym that had an F in it that wasn't the F word, because I'm from New Jersey and we say that word like we need it to breathe. I really can't come up with anything, so that's what we're getting. You can remember this by thinking when you're done with this class, you're going to think good effing riddance. G, F, R. So that will help you remember the order of the layers, and to help you remember the types of hormones from each, you're going to remember salt, sugar, sex. Salt, sugar, sex for the first three. Short-term stress for the medulla, because like I said, those are your fight or flight hormones. Adrenaline, more common, the more proper term is epinephrine, norepinephrine. All right, so the reason you need to remember salt, sugar, sex is because each region secretes a different class of hormones. The first region secretes mineralocorticoids. So the mineralo is why you have salt. So we say like that is the family. The specific example of a specific hormone in that family, like the most famous of them would be aldosterone. So that is going to be the pattern for the other two, and take note that they all the families end in corticoid. So you have mineralocorticoids for salt, glucocorticoids for sugar, and the specific example of a glucocorticoid is cortisol. More on that in just a second. And the zona reticularis is gonadocorticoids. So think like, what do your gonadal arteries go to? What are gonads? Gonads are ovaries or testes. So that's why it's sex is what you're going to use to remember it. Or a specific example will be androgens. I actually need to look into that because I'm not even sure like that's a specific hormone or if that is also a class of hormones. For now, let's just like live with the uncertainty, and when I figure it out, I'll put a pinned comment in the description. All right, so the reason I said that short-term stress is the medulla is because cortisol is a long-term stress hormone. Like it does raise your blood sugar, but it raises your blood sugar because you are under stress and your body kind of thinks like it's go time. It wants you to be ready to physically deal with all of the stress you're encountering. It's just your body cannot differentiate from psychological stress and actual like a physical threat. So it's all the same to your body. So if you're stressed out like you probably are from this class, you will have higher levels of cortisol. All right, so I believe that's the end of what everything looks like and the specific parts. So now I just want to give you a second to like look at them all side by side, try to recall what they are, and then we'll look at them individually and see if you can at least identify what organ it is. 10 seconds from now, answers are coming up. All right, so remember pituitary, 2 distinct regions. Thyroid, you have the thyroid follicles with the smooth islands surrounded by a necklace of follicular cells. You see those smooth islands next to a big clump? Well, you know it's your thyroid and parathyroid. The thymus has the like individual sections called follicles with the cortex medulla. Adrenal glands has the more subtle layers and more numerous layers compared to the pituitary. And the pancreas has cellular islands. Don't confuse them with the thyroid, which has these smooth pink islands. All right, so the upcoming quiz is just name. If you can name the structures to yourself, great. I'm not going to name them. So I'll do 10 seconds, then the answer. So this is the pituitary. 2 distinct regions, sometimes a third color region will be present, kind of dividing the two. If you go to my school, don't worry about that third color region, just ignore it. So this is the thyroid. because you have those smooth pink pons with a necklace of cells on the outside. So this is the adrenal gland. Once again, like you see multiple layers. It's more subtle than the pituitary layers, and more numerous. Just to show you, compared to the original we looked at, that's what we looked at before. And this kind of shows you, like, this is why you don't rely on color too much, because it could look very different depending on how it was stained. I think as long as you know, like, okay, we see a little fat out here, that tells us, like, okay, this is the capsule. I feel like the connective tissue capsule is always very obviously the connective tissue capsule. And then if you also look for the medulla, this is the medulla in here. It is a darker region, or it's usually like it's very distinct compared to the other regions. Like, it's always not the same shade of red or purple. Apologies to anybody that is colorblind. You're out of luck on this one. But if you can find the capsule and you can find the medulla, then you know somewhere in there are 3 layers. In this one, the first layer is like right here. I only kind of know it's the first layer because I've looked at enough of these, and because, like, that's the capsule. I know right underneath it must be the first layer. Then kind of in the middle, I just like say, okay, that's the second layer. And then this third layer actually is pretty distinct from the other 2 and is also right next to the medulla. So sometimes it's not always like picture perfect. You just kind of have to guess. So this is the pancreas. You can tell because you have cellular islands. The island is like very different from what's around it, and it's chock full of nuclei. That's how you know it's full of cells. The thymus, this is island and island. So this is the first picture I showed you was from farther away. This one's just closer up, but you can still see like the distinct separations between the thymus follicles. And remember, I feel like these are so easy, we can just review them with the names. The inner layer, medulla, outer layer, cortex. All right, this is just an adrenal gland. This is just a bigger section than what you've seen. So this is either like a transverse side to side cut or like a top and bottom cut. So like, let's just say it is a top and bottom. Let's go with that. So this is the top of the adrenal gland. This is the bottom. So they cut straight through, and what you have seen before, they just go top to middle. So this is the picture I showed you before. See this hole here? It matches up with this hole here. The smaller picture is just a cropped of this larger picture. So this whole thing is the adrenal medulla, that whole inner area. And then, you know, from here to there is the adrenal cortex, or if we're going this direction, from here to here is also the adrenal cortex. All right, so here's the ones where I specifically have the questions about the structures. I'm going to do 15 seconds per slide, then change it. So pause if you need. Answers in 3, 2, 1. So this is just a closer of the same picture. This is the pituitary. You saw those two distinct regions. This is what I meant when I said sometimes like there's a third color region. It's called the pars intermedia. If you go to my school, you don't need to know that term. That's just what it is. Remember, think pale pink posterior. It's pale pink because it is neural tissue. The darker region is darker, partly because like there's so many nuclei, and because it's mostly cell, like there's like more organelle type things, and it just stains darker than nervous tissue. And so for the school I go to, it's just a safe idea to know at least 2 hormones from each region of the pituitary, and at least 1 hormone from each endocrine gland. For the posterior, only releases 2 things, ADH, oxytocin. The anterior pituitary, you can remember all the hormones it releases by remembering flat PG. If I was smarter, I would have done it in order here, but that's FSH, LH, ACTH, TSH, prolactin, growth hormone. If that's all new to you, that's for another day. At the pointer is a pancreatic islet. Remember beta insulin, glucagon alpha. And remember it's a heterocrine gland because it has endocrine tissue and exocrine tissue. So this is a really ugly picture. I'll give you a hint. There are multiple very subtle layers in here. Answers in 3, 2, 1. Or not. All right, so this is the adrenal gland. This is the zona fasciculata. Once again, like, even though this is a terrible picture, this is like the guessing game of like, okay, like I see like a darker area in there, that must be the medulla. I see capsule over here. I'm kind of in the center next to neither of them. Let's just say zona fasciculata, because that's as close as we can get to accurate. Answers in 3, 2, 1. All right, so this is the thyroid, because you see those big smooth ponds. The cells around the ponds are follicular cells. Remember those release T3, T4. The big clump of cells that's not near, or that is in between the thyroid follicles, that is your parafollicular cells. It releases calcitonin. All right, guys, that's all the questions I have for today. I've been doing anatomy for 12 straight hours, and I can't see straight. I hope that was helpful. Have a great day, and have fun learning.